When that vaccine arrived on our dock, when the first dose was administered here, there was not a dry eye in the room.
I'm Jen. I'm an LPN at Exodus Place. Exodus Place is a nonprofit transitional housing program for men. We work with a high-risk group and have had a few COVID outbreaks in our facility. We have a great relationship with Kent County Health Department, and we know they're trying to get everyone vaccinated as soon as possible. So we reached out to them to see if they had a message for our community.
My name is Steve Kelso. I'm the Marketing and Communications Manager for the Kent County Health Department. To be honest with you, for about 9 months, a lot of the people in the Kent County Health Department felt like they were just getting kicked in the gut pretty much daily. We didn't have a real tool. We didn't have treatment. We didn't have a vaccine. When that vaccine arrived on our dock, when the first dose was administered here, there was not a dry eye in the room. For the first time, our public health nurses had a real tool, had an offensive weapon, had something that they could do something with to save lives. That's what public health is built for. You would think that the public health nurses in our department have just come out of the locker room at halftime. They now have the football in their hands, and they have the opportunity to score with it. Currently, we continue to get as many needles into arms as we possibly can. I think we may have found some solutions in West Michigan that may be unique. And among those is this collaborative effort that we formed at DeVos Place between the Kent County Health Department, Spectrum Health, Mercy Health, St. Mary's, to vaccinate as many as 20,000 people a day. It is an amazing operation that is being set up down there, and I can't wait to see it run full tilt. Our big frustration right now, as I'm sure you've heard, is we simply could be doing a lot more vaccine if we had the vaccine in our hands. Because it is in such limited supply, we need people to have a deal of patience and grace with us. It is going to be a minute before we can get everyone vaccinated because we simply don't have the vaccine. We need people to understand that and help us out with being willing to wait. And we just need to appeal to people's better angels and ask them to respect what their place in the process is, in the phases, and respect the fact that this is going to be a couple of minutes. Another issue is people are going to have to understand that even once you've been vaccinated, that wearing of the mask has to continue for at least the short term until we know better, until we know epidemiologically that we are on top of this. It still may be possible to spread the disease once you've been vaccinated. And man, I get it. I'm frustrated too. This has been a long haul. But I really think that each day is one day closer to this being over. And I think we should take heart in that and celebrate that and just be willing to hold on one more day. I promise it's coming. Myself and a lot of my colleagues in public health are very concerned about things that COVID-19 has maybe wrought in our society that we are becoming aware of. Isolation is not good for mental health. Mental health was a huge public health issue long before we had coronavirus. Substance use disorders. We see evidence that these are on the rise. And some of the maybe very real gains that we had made in battling it, we may be slipping off of. The social determinants of health. Those things that are defined as where you live may impact how your health is. We certainly have seen the Black and Brown communities suffer more from this disease. We're going to have to research and find out more about why that is. And what is my perspective on people who are suffering from homelessness and their need to be vaccinated? In all honesty, they need to be vaccinated as much as any other segment of the population. However, they face a unique set of challenges because many of them find themselves in missions and shelters. These are congregate living centers where we know the disease can pass easily. We've worked very, very closely with this community in our health department, and they've done a great job.
So I reached out to Kent County Health Department to see where we were at with vaccinations. She responded quickly, wanting to know how many men we have 65 and over, and how many staff members we would need vaccinated. So we're just kind of waiting that out. Our second option is I've been registering the guys for the DeVos Center through Spectrum. So they come down and we go through the questionnaire together. If they don't have an email address, it comes to me. And then as soon as they are ready for our guys, I'll call them down and we'll set a time and they'll go get vaccinated.
We're coming for you, Rona.